more and more people are being tested for the coronavirus, including here in the Tri-County. I talk exclusively with Federal Healthcare Network CEO Aretha Jones Powers for this edition of Quintin's Close-Ups. And if you haven't already, subscribe to my YouTube channel and like Quintin's Close-Ups on Facebook. Aretha Jones Powers, welcome to Quintin's Close-Ups.
Thank you for having me.
Oh, you're very welcome. Obviously, you are the CEO of the Federal Health Network.
Yes, I am.
What is it like to be you these days in the midst of this coronavirus outbreak?
Well, definitely have to be adaptable. Not much rest because we have to find a way to still thrive in this challenging time.
And you know, you talk about those challenging times. I just got an update from DHEC just a couple of minutes ago, and it reads this: 1,850 cases. But thank God there's no new deaths in South Carolina. So that's a 21.6 positivity rate. But there are 214 cases in Charleston County. When you hear that, what do you say?
I just wish people would start to really take it seriously. You know, you're out and about and you still see people without face coverings on. Not socially distancing themselves. And so I just don't think people are taking it seriously.
And let me jump right into another issue, what's going on right now, because obviously we're heading in towards the end of August and school students are heading back next month. But Governor McMaster is basically saying, hey, let's wait until Labor Day so that we can make sure everybody is on the same page, making certain that students who want the option to do it virtual are the ones who want to do it indoors. If they want to do it indoors, Ms. Powers, will any of the area teachers and staff have access to immediate and ongoing testing with Federal Health Network?
So we have a schedule. I don't know that it'll be immediate. We try to test 2 to 3 days a week. Also, there are other partners in the community that are testing, but we definitely will work with the school systems to ensure that individuals are tested.
And let me ask you this too, and during this entire coronavirus outbreak, is your organization following the CDC guidelines, or are you following what the president's saying?
We're following the CDC guidelines. We're trying to do everything we can do to ensure that our staff and patients are safe.
Safe. And how is that procedure right now?
So anyone that enters our facility, their temperatures are checked and they complete a questionnaire that talks about the symptoms that CDC has posted, asking if they've experienced any of those in the last week.
In the last week. Now, let me talk to you about testing. Testing versus infection. How many testing cases are you seeing at Federal, and how many are actually infection cases?
So our numbers are identical to what you're seeing in the state. When the state was right at about 5%, our positivity rate was at about 5%. We've seen that rate go from 5% to 16% to 23%. On some days we've had as high as 35% positivity rate.
Wow. And you know, any cases by chance, Ms. Powers, that are coming from antibody cases?
Say that again.
Yes, ma'am. Any cases that are coming from antibody cases by chance?
So we're not doing antibody testing. We're only doing the swabbing.
Swabbing. Let me ask you this too. Any overcount or undercount cases of COVID in the area that you know of?
No, our numbers are accurate. We're only reporting who we test on.
Test on. Now, when you talk about the coronavirus, does the coronavirus case equals a person or does it equal a test?
It equals a test. So there may be individuals who have repeat testing.
Have you seen any of those repeat cases at Federal?
Yeah, for individuals who test positive, typically they will take tests until they test negative because their employer would want a negative result.
That's exactly right. Now, Ms. Powers, what's the average age of people in the area with infection? And is that average getting lower in your mind?
Absolutely. When we started out, I think there were older adults that were testing positive. We've definitely seen a lot more younger adults under 40 testing positive.
And how many of that have you seen in the past week, say?
I would say over 40% of our cases that are testing positive are below 40 years old.
40 years old. And this is another big topic around the neighborhoods, of course. But what are the clear disparities of COVID-19 cases among minorities that you are seeing?
So we have seen a high infection rate in Hispanic populations and in the African American populations.
And which is higher, African American or Hispanic?
For us, it's actually been the Hispanic population.
Wow. And I know that obviously you look at stats all the time. What stats are you looking at when it comes to contract tracing, that is?
So we depend on DHEC for contact tracing. Our positives are contacted by our agency as well as the Department of Health.
Department of Health. What level do you want the COVID cases to come down to that would no longer require testing and contract tracing and people being quarantined?
It would have to come down to what we saw after the stay-at-home orders, which was below 5%. At this rate, I don't know that we can do enough testing in the community to stop the spread of the virus.
And how many testings have you all been given out to the different areas of Charleston?
So that's a good question. When we first started, we were testing about 150 to 200 people a day, and now we're testing upwards at 700 people a day.
Wow. After, people have been tested for obviously the coronavirus and the results come back positive in some cases, but some can be obviously asymptomatic and sent home to quarantine for 14 days. What are the next steps for that particular person?
So if someone receives a positive result, they get a conversation with our medical provider. We also follow up with that individual in 10 days. If they're asymptomatic, we offer them if they're asymptomatic, they can come back for testing. But if they're still experiencing symptoms, we don't test them until they're 3 days symptom free.
And how many people have been coming back who are asymptomatic?
I don't have the percentage, but definitely a high percentage of individuals.
And let me ask you this. This might be a tricky question, but are there any side effects to the coronavirus that you've heard of thus far?
Yeah, I think it's still too early to tell. A lot of people experience a long time with no taste or smell. But it's still just too early to tell.
Now, a lot of people love to, obviously exercise and go shopping, and they want to do normal things right now. But what are those activities that could be a high risk for people during this coronavirus outbreak?
Well, definitely when you're shopping or exercising, if you cannot properly socially distance, if you're not in a place where you can wear a mask, it's kind of difficult to wear a mask and exercise. But if you're going to go to the gym or you're going to be in crowded locations, it's mandatory. So you have to find a mask that's comfortable, that you can keep on doing that activity.
You know what, Ms. Powers, I forgot to ask you this, and I just had this conversation with a friend of mine on the phone, and we were talking about the immune system. What can people do to protect their immune system right now?
Stay home. Try to limit the amount of people you're around, and do all the things that you traditionally do to try to stay healthy. Exercise, but do it alone. If you take supplements or vitamins, continue to do those things. Eat healthy. But just everything that we would traditionally do to try to stay healthy. The biggest part is you have to isolate yourself in a sense, and that's the hardest thing for us as human beings.
Yes, ma'am. How many cases can be lowered in your mind by easy access to accelerating testing?
I think accelerated testing is going to show us more positives. I think the only thing we can do is make some better decisions. Stay home, socially distance, wear our mask, wash our hands. I think at this level, it is up to us to have some personal responsibility and accountability. That's the only thing we can do at this point to lower the risk.
And what is the typical recovery rate in your mind for the coronavirus?
We've seen people positive as long as 25 days.
Wow.
Some people recover faster and they have a negative result sooner than the 25 days, but at least 14 days.
14 days. And I know this might be a redundant question, and I was just talking to Bishop Steve Wood, who survived the coronavirus earlier this year. He's one of the first people in South Carolina to test positive for the coronavirus. But I asked him this: are there any GI effects to this? Are there any in your mind?
Yeah, a lot of people who come to get tested don't realize that some of the vomiting, nausea, diarrhea were actually signs and symptoms of the coronavirus.
Wow. let me ask you this too. In what areas of this particular low country do you want to increase testing by?
I would have to say, at this point, we've been doing testing in Charleston, Berkeley, and Dorchester counties, and all of those counties have been very receptive. The county that's been the most resistant has been Colleton counties. So definitely don't leave out the rural counties. They need to increase testing.
And what has been your biggest testing location in Charleston, Berkeley, and Dorchester?
So in Charleston County, it was at Trident Tech. Just the locality allowed us to have a large volume of individuals. The Moncks Corner Berkeley County site, we had a stationary location there, and it did well. In Dorchester is typically one of the churches, one of the larger churches. But we're to the place now where you have to have a large parking lot to accommodate at minimum 600 people.
And when you come up to those testing sites, what can you expect?
So patience. You have to be patient because we're trying to register a large volume of individuals. Please make sure you've already used the restroom, you have gas, because a lot goes into mobile testing. We have to jump people's batteries off, provide gas for them. Mobile testing can definitely be very interesting.
Oh, for sure. And let me fast forward. What type of vaccine would be ideal right now?
At this point, just about anything that can slow the spread. It would be great to have some sort of comprehension of immunity and what exactly that means. And that's above my pay grade at this point.
I understand that. Well, Aretha Jones Powers of Federal Health Network, thank you so much for your time. And again, welcome to Quintin's Close-Ups.
Thank you for having me.
You're very welcome.